Hi, I'm Allie. I'm currently interning at the Center for Service and Social Justice, and today Dr. Mantione has come to sit with me and talk about her work at the Leahy Clinic and Center. So I want to thank you again for deciding to interview with us, and I'm just going to ask you a few questions. So let's get started. Tell us about your center and what its mission is to help with the community.
Well, the Leahy Community Health and Family Center is located in the lower level of McGurran Hall, and it was dedicated in the spring of 2003. And the mission since that time has been to provide a place where there can be innovative opportunities for the faculty, for the staff, and students to work with the community together to fulfill gaps in health, wellness, education services, mostly to the marginalized and underserved, and to fulfill the value of a Jesuit university. And the center has actively sought to uncover gaps in services and work with community agencies and individuals to develop meaningful, sustainable responses to their needs. Some of the programs developed by University of Scranton staff and faculty and students as well that have been offered by the Leahy Community Health and Family Center are, for instance, the Peacemakers after school program. This program is offered by the Counseling and Human Services Department, the graduate students, and it's a 6-week long program that's offered every semester. It was originally created by Sister Ann Cairns in 2005, and it's for children ages 9 through 13. The program continues to be developed with an overall mission of Sister Ann's to empower our young people to build peace and justice in the world. This is accomplished through activities and play, and nutrition. It focuses on nurturing self-awareness of the participants and with ultimately learning how to respect others. One of Sister Ann's quotes I'll always remember is, "We are carriers of peace to all of those who share life with us." So it really is a very popular program, and it is implemented by the counseling graduate students. Another program that we have in the Leahy Center is the University of Success, and this is our pre-college program, and it's designed to provide academic and social and cultural enrichment to high school students. And the goal is to assist first-generation and low-income students to successfully complete high school and gain entrance into a college or university. And this, we have found, is achieved through a variety of activities and services. And it is primarily for participants in 9th through 12th grade. The students sign on for the 4 years. They come on campus 1 week in a month, and they're mentored by our individual professional staff and our faculty. They're also mentored by University of Scranton students and students in other majors who are just interested in working as a tutor or just want an opportunity to encourage young scholars to pursue their dreams. It's a very popular program that we have. The other program that we have is the Alice V. Leahy Food Pantry. This is a program where students collect and they distribute non-perishable food items to individuals in Scranton. Our University of Scranton students are responsible for collecting and organizing the food drives. They're also responsible for packaging it and providing it to our clients. We cooperate and partner with other community agencies such as the Weinberg Food Pantry and Lackawanna County Gate and St. Gregory's Parish in Clark Summit. In the year 2019, we collected over 6,500 pounds of food.
Wow.
We distributed it to 350 families, so that totals about 1,200 individuals. So we do provide a lot of food for a lot of people in our county. And then our other program I think that we're most famous for is the Edward R. Leahy Jr. Clinic for the Uninsured. So that project has been operating through the center from November of 2007.
Wow.
It's the only free clinic in Lackawanna County offering healthcare for the uninsured and the underinsured. Services include a low vision clinic, physical health clinic, physical therapy clinic, behavioral health. All of these are provided by our graduate students, supervised by their faculty and licensed staff. And then the medical care in the clinic is provided by an on-staff nurse practitioner and volunteer physicians and nurses from the community. Also, our undergraduate nursing students participate in the Leahy Clinic, our health administration, and our pre-profession students also lend a hand in that clinic. Another big part of that clinic in the entire center is language interpretation. So because we serve a population of predominantly Hispanic Latino, approximately 86% of our patients are Hispanic Latino, and of them, approximately 70% are only speak Spanish. So we have a core group of language interpreters who are students, second language speakers, and they're supervised by our University of Scranton professional staff to provide these services.
Okay. Wow, that's great. Yeah. So then I was going to say, through working like all your hard work through this center, do you have like a specific accomplishment that you think is the best or that you're most proud of?
Well, over the past years, we've had many accomplishments. We've had many awards, many certifications. I think the thing that I am the most proud of, and the staff is the most proud of, is that we have gained the trust of the community. And that, I think, is our finest achievement. When we first began, it was very clear that the population we served was not comfortable coming onto campus. And they were not sure about if we were going to actually achieve what we were promising them. Mm-hmm. But after now 13, 14, 15 years, the community really does count on us. So we have become leaders in the community in uninsured healthcare. And we are a safe place for people. So for people in the community who are marginalized or feel very vulnerable, we are a safe place for them. And even during this pandemic, with our doors closed to the community, we are getting calls all the time from our community partners and our collaborators and the public seeking guidance on how best to take care of themselves. So since 86% of our population is Hispanic Latino, and they come from a different culture and they might not speak the language, I think one of the biggest questions we get is, what does this mean? So what does all of this mean? So we're still trying, we speak to people all the time on the telephone to help them understand what it means to be in this pandemic and what they need to do to keep themselves healthy. It was clear to us very early on in the pandemic that the information was not getting to the most vulnerable. So we were trying our best to speak with everyone individually and get them through the challenges that they have every single day.
Yeah, definitely. It's a lot of work, I can't imagine.
We enjoy it though, we love it.
Yes, of course. So do you think that by working here, there's been a specific difficulty or challenge or obstacle that you've faced? I guess even like before the pandemic, just like in general.
Sure. Well, always, I think gaining the community's trust is always a big obstacle. The other obstacle, obviously, now is during the pandemic because patients need to be navigated and don't quite understand the landscape of what is going on. That's always very challenging. But again, today, our biggest obstacle, our biggest challenge today is just maintaining the trust that it took us so long to gain. We do hope that the community does come back to us when we open our doors after this pandemic. I do believe that they will. We get phone calls every day from people saying, yes, we can't wait for you to open your doors again. And I do think but that is the most difficult thing for us to handle right now at this stage in time.
Yeah,
and our students can't come here either to give back to the community. So that too for them has been a challenge.
Yeah, I can't even imagine. I mean, I know I used to volunteer at the food pantry.
Wonderful.
Yes, it's missed greatly.
Yes, thank you. Thank you for doing that. Yes. So we have been working in the food pantry, although we can't bring the people here, but we have been working to distribute some of the food through other organizations.
That's great. Because leads me into my next question is like, even though like we're in this pandemic, how are you still contributing like to the community?
Sure. So again, we're here to help community members understand and navigate the system. And this is a very traumatic time for them. They have family members who they've lost during this healthcare crisis. They haven't yet been able to grieve. They're losing their jobs and they're looking for sources of income. So one of the things we're doing to contribute to that is we're collaborating with our community partners. So we can't physically have people on our campus, but we can help them with our community that we serve. So we're able to offer food to support their pantries, our expertise to help them navigate our patients through their systems. We're transferring the care of our patients to another facility. So we're working with them to help them offer the best care they possibly can to our patients. And we're preparing for the day that we can once again invite the community onto our campus and physically meet them in our Leahy Community Health and Family Center. And our students are definitely preparing to continue the mission of this Jesuit university.
That's great. Thank you so much again for sharing all about this amazing program. And it's so amazing that it's offered at the university for everybody.
Yes, Allie, I think we're very fortunate.
Yes, like it's amazing. So I want to say thank you, and I want to get the word out and tell students and people like there's opportunities still out there and to contact you for more information. And thank you.